Hello viewers of Sawa Sawa Network, welcome to another edition of the Weekly Forum, a program that discusses issues that are affecting the lives of South Sudanese in their daily lives and in peace building. My name is Daniel Juma Maidodo, and in our today program, we are going to be looking at the HIV/AIDS prevalence in South Sudan. My guest is Dr. Hariet, the Director of HIV/AIDS in Juba, South Sudan. Dr. Hariet, welcome to the program.
Thank you for having me.
According to the USAID and several reports, HIV/AIDS remain one of the main public health issues in the country. And it's also stated that at least youth that are below the age of 45 are living with HIV/AIDS. What do you make of this report from USAID?
Normally the USAID reports are country reports. Countries submit their reports on annual basis to the UNAIDS. So just to give you a bit of a background about HIV/AIDS in South Sudan. HIV/AIDS is one of the public health threats in South Sudan. And currently, as I speak to you, it accounts for a prevalence of 2.1%. This means for every 100 persons tested in the country, you will always find 2 who are positive for HIV. We also currently did an estimate, which we normally do also on annual basis, and that estimate has estimated that in South Sudan, we have about 173 people living with HIV. And it also estimated that about 8,000 deaths from HIV are reported on annual basis.
When you talk about the figures, the statistic you are putting out here, how is the response of the people when maybe you call them to go for checkup? The response positive from the public?
Normally South Sudan is one of the countries which are still facing issues of stigma with HIV. So HIV in South Sudan is still stigmatized, but compared to the previous year, people are now coming out. So just to give you a bit of statistics regarding the HIV cascade in South Sudan. So the cascade actually reports on the global targets. So the global targets has, we have global targets to achieve 95% of people living with HIV knowing their status by the year 2030. Just to tell you where South Sudan is, currently our data shows that we are only able to achieve 37% of the population who know their HIV status. So this is still very far from reaching the 95 global targets. And that is where the issue is, because we still have a challenge. It means we still have people moving around there who have not come out to get tested and know their status. And in South Sudan, we already have taken note of that. We are currently working with partners to find the best possible strategies to reach out to people so that people can easily get tested. We have just implemented what we call the HIV self-testing. So HIV self-testing is a testing kit which is given to individuals who can go home and perform the test, and once they confirm they are positive from that test, they will be able to report to the health facility. So this test is also good because for people who are not able to come to the health facility, it will improve the access in terms of testing. So people will really be willing to test, and of course it will improve our coverage in terms of testing and in terms of people knowing their HIV status. And
the reports also from various sources indicate that most people affected by HIV/AIDS are the youth. Why do you think this HIV pandemic is so much common among the youth?
Well, of course, the youth, the youth are normally sexually active, so when you are between the age of, let's say, from the age of 18 to, let's say, about 39, you are really sexually active, and this is one of the reasons why HIV is very common among them. HIV is a disease which is transmitted sexually.
Okay.
So being sexually active means, you know, most of the time having multiple partners, having a number of, you know, casual sex and all these kind of sexual activities, which are very common among youth, promotes HIV transmission. And that's why we have a high prevalence of HIV among youth.
You mentioned about 47%, which means there is still a percentage for us to reach the global percentage that is required. And you also already gave us the reason why that is. But overall, the statistic of South Sudan, as we talk now, what is the statistic of people who are living with HIV/AIDS?
Currently, we have, so the latest estimate of 2021 shows that we have about 173,000 people living with HIV/AIDS.
And these people, how are they responding to the basic medication? Because we know that the people living with HIV/AIDS, they can get some medications like the ARVs. Maybe you can update us about the general welfare of these people living with HIV/AIDS.
Okay, from the estimated 173,000 people living with HIV/AIDS, currently we only have 27% of that figure who are receiving antiretroviral treatment. Of those receiving antiretroviral treatment, we also do what we call the viral load. So the viral load will give us information on how they are responding to the treatment. So normally with this treatment, we expect that their viral load is reduced to a level that they cannot even transmit the disease. So those who are being tested for viral load have shown good results, up to 84%, though the global target is at 95%. So in terms of viral load testing, the clients, the HIV clients are doing well. So in terms of the testing results. But in terms of the coverage, again, only few of them are able to perform a viral load. Currently, the figure stands at about 47% who have a viral load tested. Our statistics at the hospital in numbers shows that, so in numbers we have 47,000 who are taking antiretroviral treatment currently.
Thank you. And if we look at this number, as put it is 27%, to me there is still low turnout among the people living with HIV/AIDS. What can be the reason behind this? Why are they not, once you know your status, why are they not going for these services that you're talking about?
So one of the reasons still remains the issue of stigma.
Okay,
so I keep repeating that. Stigma is still very high in South Sudan. Secondly is the issue of access to the treatment itself, because most of the people live in areas where they cannot easily access these services. In the country, we currently have about 151 health facilities providing antiretroviral treatment for HIV patients. So, of course, this is not enough to cover all areas. And most of the areas do not really have a facility providing these services within their catchment areas. So that is one of the challenges we are facing. And thirdly is the issue of awareness. So we still need to do more and more awareness to explain to the clients, those who are tested positive, what does it mean to take an antiretroviral treatment. This treatment is a lifelong treatment, and by taking this treatment, it gives you a lot of hope, because once you are on treatment, your virus will be suppressed and your health status will be improved. You will live long, even if you have HIV, so you can live a normal life like anybody else. And that is the message that people need to understand, that if you really take it well, the antiretroviral treatment well, then you really have high chances for living longer.
Somebody living with HIV/AIDS that is watching you through this program may be asking where some of these centers are in the country. Maybe can you take us through where some of these services, where these people living with HIV/AIDS can find these services?
Well, the services are available across the country, but most of the HIV testing facilities are within the capital, that is in Juba. So most of all these health facilities provide this antiretroviral treatment. But also in the states, especially mostly in the main state hospitals, we also have an ART center to provide services. So we basically have it across the country, but of course it's not covering all the counties. That is the only challenge we have. And the good news is this treatment is offered free of charge. You don't need to pay anything to access the services.
I remember when we started this chat, you mentioned about some of the work you are doing with the partners. So apart from maybe working with partners in the fight against this pandemic, what is the Ministry of Health doing on its own in supporting people living with HIV/AIDS?
Well, the Ministry of Health is the main driver in terms of the HIV epidemic response, and it works very closely with the South Sudan AIDS Commission. So South Sudan AIDS Commission is more on the advocacy and supporting prevention activities, while the Ministry of Health supports all the health sector HIV epidemic response. The Ministry of Health, together with SAC, developed a 3-year strategic plan. And in this 3-year strategic plan, it has a clear goal for the country. So the South Sudan goal to address HIV epidemic says we want to see that by 2023 we have reduced the rate of HIV infection to by 50% of the 2010 levels. So we want to see a reduction of 50% in new infection. We also want to see that HIV deaths, so deaths related to HIV, are reduced by 50%. That is comparing it with the 2010 level. So this is just a 3-year plan, but of course this plan is ending in 2023. We are currently preparing ourselves to do a review of the current strategic plan and develop, hopefully by next year, have a new plan in place. So this plan has very clear strategies of what the government needs to do, and one of the key areas is looking at the area of prevention. So in prevention, what the government has put in place is measures, first of all, to reduce sexually transmission disease, and to do that, of course, we promote the correct and proper use of condom, and then to also reduce the rate of hospital-related HIV transmission, of course, through having a robust reverse infection control policy at the hospitals. We also have, in our strategy, we also clearly stated that we want to reduce the rate of new infection among pregnant women, because HIV can be transmitted from mother to child. So in this strategy, we have put plans in place where pregnant women come to the antenatal clinic when they come for pregnancy follow-up. We do an HIV test, so for all pregnant women, and if they are positive, we give them medicines during their pregnancies, and that medicine will prevent the newborn babies from getting infected with HIV. Under prevention, we also have strategies to address issues of stigma, including awareness programs on HIV/AIDS. And we have also included issues related to SGV, that is sexual gender-based violence, how we can reduce that in the country. So we also have strategies to reduce that, and also strategies to ensure that we are able to provide protection to the most vulnerable populations. So this is under prevention. One of our strategies is really prevention. And secondly, the Ministry of Health has also put in place strategies towards treating for those who are already positive. So we are working with partners to ensure that we have sufficient antiretroviral treatment to cover all those who are already tested positive. And the drugs are already available through support from the Global Fund. Yeah, through support from the Global Fund. And in addition to that, we also have strategies under treatment to improve the health outcome of those who are already on treatment. And this is through ensuring that we keep checking their viral load. So if it's going low or it is still high, because still high sometimes means the patient is not responding to treatment. So in that case, you need to assess the patient on why the viral load is high. And once the reason is known, if it's due to the fact that the patient is not taking the medicine, then you do what we call the adherence counseling. But also if it's due to the medicine itself, because we also want to make sure they are taking medicines which are efficacious. So if there is issues of efficacy of the medicine they are taking, we will also take measures against that. So basically these are some of the plans, but the Ministry of Health has really put down clear plans to address prevention and also to address treatment. And of course, to be able to do that, we also have plans, for resource mobilization and making sure that we have always sufficient funding to respond to the HIV epidemic. So one of the resource mobilization strategies that we really need to improve on is the domestic funding. Because currently the government funding for health is still very low. We still have hopes. And the current approved budget has also given us more hopes that the government in the future will be able to invest more and support most of the HIV epidemic response in the country.
Thank you. I just wanted to take you back to the partners that are supporting this, especially the Department of HIV/AIDS, and to maybe share with us how is the cooperation between the Ministry of Health and these partners.
Well, the Ministry of Health has, over the past years, the two main donors for HIV is the Global Fund, and we have the PEPFAR funding. So PEPFAR funding is from the United States government. So these are the main funders of the HIV response in the country. But what I can say is we have had very good collaboration and working relationship with the partners. Over the past years, we had continuous funding. So they have never stopped supporting the country in responding to HIV/AIDS. And they are still willing, so that commitment is still there. So we have already submitted new plans for the PEPFAR funding, which is already in process, and hopefully by October we'll still have another more funding granted for the next year. The Global Fund the same. So we still have hopes because the donors themselves have given us that hope that they are still committed to support South Sudan in funding the HIV response.
Dr. Hariet, thank you so much for speaking to Sawa Sawa Network. What is your last message to viewers of the weekly?
My last message to the viewers is HIV/AIDS is real. South Sudan is also among the countries suffering from HIV epidemic. My call to everybody is, first of all, let us stop talking about HIV. We need to come out, get tested. It's very important to get tested for HIV because once you know your status, if you are negative, you will continue to encourage yourself to stay negative. And if you are positive, you will also continue to live a positive life by reaching out for treatment, and the treatment gives you a lot of hope. So I really want to encourage everybody to come out, test, get to know your status, and live positively.
Dr. Hariet, thank you so much.
Thank you for having me.
For speaking to Sawa Sawa Network.
Thank you.
Dear viewers of Sawa Sawa Network, we have come to the end of the program. And as you have heard from Dr. Hariet, the Director for HIV/AIDS in the Ministry of Health, HIV/AIDS is real and is living with us. And the only way you can be safe is to go and test your status so that you are on a safer side. Stay tuned, and if you want to get more information on this show, follow us on Facebook page, Sawa Sawa Network. You can also follow us on our YouTube channel, also Sawa Sawa Network, and on our website, www.sawasawanetwork.org. My name is Daniel Juma Maidodo. See you next time.